We are always worried about prostate health, and the most concerning can be prostate cancer. So I'll be breaking a lot of myths today about prostate cancer and prostate health. The first one is all prostate enlargement are cancerous. No, it is not true. With age, benign enlargement of prostate happens. It is not always symptomatic also, but in some percentage of men, it can be cancerous and it has to be diagnosed timely. Prostate cancer is always aggressive and deadly. No, it is not true. If it is diagnosed within early stage of the disease and proper treatment is initiated, in fact, the prostate cancer has best treatable cancer among men. Although being second most common cancer in men, it is 17th cause of death if it happens and not being treated properly. Having a high PSA level always means you have prostate cancer. PSA is definitely one of the markers to diagnose prostate cancer, but high PSA doesn't always mean you have prostate cancer. PSA can increase in prostatic instrumentation, catheterization after sexual activity, and also due to prostatitis or infection. So if PSA is high, it doesn't always mean to be cancerous. It has to be further confirmed with further diagnostic test. Prostate cancer only affects older men. Although it is true, it is not very common to have prostate cancer issues before the age of 55. But prostate cancer can happen in younger age, especially people who are smokers and people who have family history of prostate cancer. Prostate cancer has obvious early symptoms. No, it is not true. Unfortunately, prostate cancer in early stages have no symptoms because it can be a very small 1 millimeter cancerous nodule inside the prostate hiding and waiting to become large. So early prostate cancer is without symptoms. The only finding one can find is high PSA or a nodularity on digital rectal examination by the doctor. Vasectomy increases the risk of prostate cancer. No, it is not true. Vasectomy has no increase in risk of prostate cancer. Vasectomy is one of the very good way of male contraception and it doesn't causes any additional risk. All men with prostate cancer need immediate aggressive treatment. No. Prostate cancer most of the time is a slow growing disease. So all men will not be needing very aggressive therapy. We can do proper testing and with time we can diagnose the stage of the cancer and accordingly we can plan treatment. Prostate cancer treatment always lead to impotence and incontinence. Erectile dysfunction and urinary incontinence are some potential side effects of the prostate cancer treatment, but it is not always the case. The newer robotic surgery modalities, they help in preserving patients' urinary control as well as sexual performance. There is nothing you can do to prevent prostate cancer. It is not true. A healthy lifestyle always has its advantages, especially maintaining healthy body weight, reducing your red meat consumption, reducing fast food consumption, regularly proper exercise and staying sexually active, not consuming tobacco products or doing smoking are important ways to prevent prostate cancer. Digital rectal examination is the only way to detect prostate cancer. Digital rectal examination can be a method employed by urologists to diagnose the prostate cancer, but it is not the only way. There are other tests like MRI scan, PSA test, and PSA also there is free PSA testing which can be done, and afterwards PET-CT, particularly PSMA PET-CT, is used to find the extent of the cancer. Prostate biopsy is one of the way to confirm prostate cancer if any doubtful area or nodularity is. By doing prostate surgery or prostate biopsy, prostate cancer can spread in the body. No, it is not true. Prostate biopsy is the only and effective way of diagnosing the cancer. In biopsy, a very small needle is passed and a very small sample of cells are collected to see it under microscope what kind of cells they are. Are they cancerous or not? So prostate biopsy is the only confirmatory way to tell and confirm the prostate cancer. And it has to be done and there is no risk of spread of the disease or increasing the stage of the cancer by doing prostate biopsy. What are the symptoms of prostate cancer? As I told you, early prostate cancer has no symptoms. So it is unfortunate, but it is true. As the prostate cancer spreads to surrounding area or it can cause urinary obstruction, you can present with urinary symptoms like slowing of the urinary stream, some blood coming in urine, developing urinary infection, going for urination again and again, taking more time in passing urine. So these are the possible symptoms. If the prostate cancer has spread to the other parts of the body, like especially bone or backbone, you can experience bony pains, pain in the back, and fall in your body weight significantly in the time of 2 to 3 months by 5 to 10%. So they can be indicating factors for the prostate cancer.